people started opening up the envelopes and seeing their premiums increase. And all of a sudden now this is real. And people have to make a decision based on their wallets. Well, at that point, a lot of people in the provider world were like, oh, well, this is going to get fixed because this is going to cause so much pain and this is going to cause so much trouble. There's going to be a fix. And I mean, my phone was literally ringing off the hook saying, oh, by April or May, there's going to be a solution. There's going to be a fix. There's going to be there might be a slide drop. So I've got a feeling that you might not be that optimistic.
Yeah. What gave it away? It's, I want to say one thing, and I say this almost everywhere I speak, and I've talked about this issue all over the country. If I had a crystal ball, if I had an accurate crystal ball, I would not be doing this.
Welcome back to MasterMined. I'm your host, Mark Scrivner, and joined, as always, Jeff Skillen. Great to have you on the show, my fabulous co-host.
Mark, I'm really looking forward to it. I've been looking forward to this all week.
Yeah, this is going to be a great episode because we're joined again by Andrew Kessler, principal of Slingshot Solutions and our DC insider on everything going on in policy. So, Andrew, excited to have you back on the show. I know we've got some great new things to talk about. I don't know how great it's going to be, but hopefully you can break it down for our audience.
Yeah, pleasure to be back. Thanks for having me again.
Andrew, is anything going on in DC right now?
Not a thing. Yeah. It's interesting that we're talking about this on a Wednesday because last night, as was the case, that's probably going to be from now until April or May, were some primary elections that and each one is going to change the narrative just a little bit. So it's fresh in our heads, and it's we're going to talk about that as we get deeper into the subject, how the news outside DC is influencing what's going on inside DC.
Well, this is 100% why we have you on, and we're so grateful that you're willing to be our man behind the curtain. One of the things that really prompted us to reach out is the buzz that we get, and of course that's been, ripping through our industry, is really the impact of the One Big Beautiful Bill and what that has done for the Affordable Care Act subsidies, and then also on Medicaid reimbursement. So those are the two areas that we'd like to spend some time with you. And I mean, just to give you an idea, I mean, we just had an interview with someone who he approached his planning in 2026 and he said, all right, I'm going to lay out a plan for disaster with the ACA subsidies. And that was going to be a 75% reduction of their market. And then their non-disaster was 25%. And they've come in at around 28%. So about 28% less business so far this year as a result of the ACA subsidy cliff. So I just want to set the table with that and then just see how you respond.
Yeah, it's that's obvious for anyone to say, their worst case scenario 75, best case 25, and to be at 28. Congratulations to them.
Right.
For now. That's good news. I don't want to take too much time about what the subsidies are about, but it is important to talk about the populations they cover. And you'll see the one difference between last session I did with you and this session is I've got a pen in my hand because I have so many notes to go to because this is such a big topic. It's not like so much has gone into the ACA and these subsidies. I want to make sure I get it right, and I'm taking little notes.
100%. No, so glad.
And it's also, I've always got a pen in my hand, and I could sum it up in 2 words: law school. Before law school, I never ever needed a pen at every moment of my life. Ever since 20-something years ago when I finished law school, you're always taking notes. It's like your brain's been programmed. If you're not taking notes, you have no prayer. So
nice.
I got my little pen. Okay, so let's talk about enough about that. Enough about my 3 years of horror in law school. So when the ACA was passed back in 2010, there were some subsidies that made it easier for people to afford care under, to purchase through the exchanges, to qualify through the exchanges, based on where you fell on the federal poverty line. And where you fell on the federal poverty line based on your income and your family size, a percentage of your income, would go towards making the payments for these premiums, and the tax subsidies made it easier to pay. The real change came during the pandemic and what followed. So first we have the pandemic, which caused a lot of people economic distress, losing jobs, losing income, losing any number of, things that we take for granted in day-to-day life. And then the inflation as a result of that. So between 2021, when the Biden administration was addressing in one of their first legislative packages the impact of COVID, and then in 2022's Inflation Reduction Act, the subsidies were enhanced. So the enhanced subsidies covered the full cost of a benchmark ACA plan if you were between like 100 and 150% of the federal poverty line. Beyond that, there were options for 200% of the poverty line, 300% of the poverty line, 400% of the poverty line, on and on. But whereas in the original ACA, if you were at 300 to 400% of the poverty line, we're talking about 10% of income towards your premiums and tax credits that covered that. That came down to like 8.5%. Other premiums that were like at 6.6%, those came down to 6%. So there was a tinkering in the formula and that was projected to be in place through December 31st, 2025. One big beautiful bill comes along, and it's interesting. People outside the Beltway call it the one big beautiful bill. Inside the Beltway, we call it reconciliation, because as I talked about in my last appearance, it's a process through which the president's agenda is set. But and we're going to be talking a lot about reconciliation on this in this session, just so you understand how it works and why it works the way it does, because that's why I'm here, and how we're going to get out of it. You can't get out of a problem until you know what the problem is.
No, absolutely.
The whole point of reconciliation is it has to, at least on paper, save the federal government money. So you have to show we're bringing these levels down, we're bringing these levels up. So at the end of the day, it has to be at least budget neutral, or technically on paper, save money. So during the reconciliation process, Trump and the Republicans in Congress said, well, if we don't extend these subsidies and bring them back to their original levels, that's going to save a lot of money. It's going to generate more tax revenue because the tax rates, the subsidies based on your income will drop, and then the subsidies will in turn drop. So we're going to be saving money so we can pay for the president's agenda. So just so you know the kind of impact the tax credits had on the market, when the enhanced tax credits began in 2021, health insurance enrollment through the ACA marketplace reached about 24 million in 2025. About 24 million people enrolled the last year these subsidies were available. The last year without the subsidies, that number was at 11 million.
Wow. So more than
double.
Mm-hmm.
This more than doubled the number of new enrollees, not people covered, just new enrollees. So 11 million in 2020, 24 million in 2025. Of those 24 million that enrolled in 2025, about 22 million received an enhanced tax credit from these subsidies. So it was the main driver for the expansion. Okay, that's where we're at. That's the setting.
So, I mean, so to Sesame Street style, as a result of these subsidies, premiums got cheaper. Therefore, more people bought them, and then the numbers more than double.
The numbers of new enrollees more than doubled. That's correct.
Okay, perfect.
That's correct.
And so that's where we are pre-reconciliation.
That's where we are pre-reconciliation. Okay. Now we are in the first week of March. And so the most recent enrollment period, you can't just say, hey, I want to enroll and go on the website. Why they structured it this way, I don't know. But there are enrollment periods where they say open, closed. So the most recent enrollment period is now over. The best way to compare is this point last year, this enrollment period versus last year's enrollment period. And there's about 1.2 million fewer enrollees between the 2026 first enrollment period and the 2025 first enrollment period. Like your friend who said he's at 28% rather than 25%, it was still more than a lot of people expected. Most people expected somewhere hovering around 1 million. 1.2 million. You're just going to have to take my word for it. I'm not going to cite chapter and verse on where I get my data from. Just take it from me. It's reputable.
Those are new enrollees.
Those are
correct?
new enrollees.
Okay, got it.
So what we're dealing with is really more on the state level, state by state, because different states have different, there's different how they take on the ACA and what they choose to engage in, and on and on and on. Different states do it differently, and different states invest different amounts in their own state enrollment. So you can't just say, okay, nationwide, here's where we're at. So just to give you an example, the biggest drop in enrollment from this year to last year was in North Carolina. 22% drop between last year's enrollment period and this year's enrollment. 22% fewer people chose to enroll. Compare that with New Mexico, for example. New Mexico is unique because they've used their own tax dollars to really build up their system, and they've used a lot of their tax dollars to offset the losses coming from the federal government. That's where they've chosen to spend. Their choice. They really didn't see much of a drop at all in enrollment numbers. So you've got California, you've got Colorado, you've got Maryland, you've got Washington. Some states like that also do a little bit like New Mexico's done. And they use some of their state money to help enrollees because they project it as a good investment. And we'll get to why in a minute. But you're always going to have a difference in states. How this affects California is not going to be how it affects Delaware. And I don't just say that because of size, or, pick two states of equal size. Take New Mexico, and compare that to the population in, let's say Rhode Island or Connecticut. It's going to be different because the states invest differently. But so we're seeing a drop, but it's not a catastrophic drop. So that's where we're at in terms of what we're looking at in terms of the numbers. But that's just where we're at in March. It's not where we're going to necessarily be down the road.
So
that's interesting. And Andrew, you said at the beginning, like this is going to be this is a big deal, but how big of a deal do you think it's going to be? Is it like something minor, turbulence for a little while, or is this something a little more serious in your eyes?
It's more serious. It's definitely more serious because, and now let's get into the meat of the impact. I know a lot of your viewers want answers on what's next, but I also want to educate them on everything I do is through an advocacy lens. That's why you have me on. So everything I'm talking about, I hope that your viewers will say, that's going to help me in preparing my, of course they're prepared if they're providers or whatever, they can talk about their own experience, like your friends who have their enrollment numbers or their 25, 28% numbers. But so let's talk about behavioral health, because that's what we talk about here. This is going to affect all of healthcare, obviously. But the impact could be disproportionate not on necessarily our populations, but on the cost to the system as a result of our populations. Uninsured populations tend to be diagnosed at later stages, the more severe the problem gets. Why? They don't have primary care. They wait until things get worse, and then they either go finally see the doctor, or what is the one way someone without insurance gets care? Through the emergency room. And this is where we're really going to talk about mental health and even possibly, a little bit about substance use disorders as well. The less insurance you have, the more likely you are to wait for the chronic disease to get worse and worse. So that coverage loss increases pressure on local safety net providers, emergency rooms, on and on.
Right.
Maybe even, as I think we talked on our last session a little bit, unfortunately, that means jails too. Because jails are almost, for people with mental health and substance use disorders, jails are where they encounter their first level of medical care.
Yeah, first intervention oftentimes is the justice.
Right, and
justice
that's
system.
a topic for another day. I can't imagine how many different episodes we're going to have to do between last time and this time, me saying topic for another day. So hospitals get overcrowded with uninsured patients, and things go downhill from there. And local safety net providers feel the brunt. By way of a vignette, I read this, and this was years ago. There was a suburban city outside Austin, Texas. Population 55, 60,000. So, the New York suburbs, the Chicago suburbs, the DC suburbs, any big city has suburbs that have cities within cities, but they're their own entities. So this city outside Austin, Texas was big enough to have its own hospital. And they did a study, and they revealed that 80% of their emergency room visits came down to 14 patients. Guess what? Every single one had a mental health disorder. And they kept coming back and back and back. Less insurance means less medication, less early intervention, less maintenance, on and on. So it becomes a tax on the system. To talk about how this will impact us down the road is really tricky, but we're going to get into some numbers that have been floating around in my space that I want to share with you. And this one I can cite just in case you have someone out there who says, where did he get that number? This is from the Urban Institute, which is, really concerned with numbers like this. Because like I said, it's the local safety nets, whether it's cities or maybe in some case counties, are going to have to bear the brunt. So the Urban Institute, their estimate is that about 4.8 million more people will become uninsured without the extension in place, and possibly 7 million people can lose subsidized coverage overall. This adds to about the 26 million-ish Americans with no coverage. That 26 million number with no coverage has been kind of steady for the last 10 years. Another great place, and I promised you when we set this up, I promised you I'd give your viewers like resources to check out for themselves. The Kaiser Family Foundation is a phenomenal health research foundation that puts out great data on numbers like this. And the Kaiser Family Foundation estimated that the average net marketplace premium payments could more than double without these subsidies in place. Why? You've got to make it up somewhere. It's all gonna, you take the dirt out of the hole here, you're going to have to fill it over there. So premium payments are going up for those who can still afford it. And that's what a lot of the angst was about when this was in the news. Premiums are going to go through the roof, blah, blah, blah. Now, when you're talking about something in Washington, just like anywhere else, when you're talking about something that's going to happen, is very different than when it does happen. Sticker shock does not happen in the abstract. Sticker shock is something that is concrete. And you could say, oh, people are going to open their bills and it's going to be. That is no replacement for people actually opening their bills and seeing how much it's going to cost. So those premiums going up, the very early data that Kaiser Family Foundation has from the states, higher premiums will lead to drop coverage or insure only select family members, not enroll anybody. Skimping, basically picking and choosing what you cover, not covering prescription drug, choosing to take on medical debt, refinancing other debt, whatever. It's leading to some really, really difficult choices for the people who rely on the exchanges to purchase their insurance.
So I'm hearing that number 20 to 30% is kind of, and I'm talking about 20 to 30% less people taking advantage of the ACA.
Yeah.
I'm extrapolating what you're saying at the federal level and then at the various states, recognizing that some states are going to be more, some states are going to be less. But in aggregate, what I'm hearing, and by the way, your data is incredible. What I'm hearing is a broad swath of about 20 to 30% less people taking advantage of the ACA. Is that fair, or am I being too general?
I haven't. Most of the number I've seen, you take me back to like fifth grade math and like figuring out percentages, and the market is so fluid. The research I've seen deals in actual numbers because we know we have this many enrollees and whatever. So I haven't seen percentages. If I get them, I'm happy to follow up. You can get it to yours. I'm dealing in growth. I mean, I guess we're dealing more in. It's like I said about sticker shock. I think it's part of the. It is far more shocking to the system to hear 7 million people will lose rather than X percent, because 20 is not a big number. 7 million is a bit. It maybe
and part of the anchor was if North Carolina was the worst at 22% less, right? Mm-hmm. And then you've got the Kaiser information that's indicating this many more will not enroll or will skimp or will only do certain things to save money so they don't have to pay more premiums. That's where I do my quick back of the envelope math.
Yeah. And let me go back to North Carolina real quick. After the reconciliation passed, before it even took effect, because it doesn't take effect until now, North Carolina, as states were, like I said, looking down the road and said, cuts are coming for a variety, not beyond the subsidies, beyond the tax credits, whether it's Medicaid, other things, they saw problems coming. And their state, whether it was their Medicaid administrator or their health office, whatever, whoever has the problem or whoever has the power to dictate changes at the executive level said, whoop, cuts, 3% across the board, more for these services, less for these services. These are going to be cuts. Now, that can be changed through statute. I happen to do a lot of work in North Carolina, so I talked to my providers down there, and they're like, no, the legislature is probably going to have something to say about it, because the legislators were like, we can override this through legislation if the governor chooses to sign it. So North Carolina was one of the first states to, I don't have a better word than, I don't want to say panic, because it's how you look. Were they panicking or was it prescient planning?
Right.
Remains to be seen. But North Carolina, it's interesting that, if you were to say to me who's going to hit the hardest, well, look, there's 10 states that don't get hit at all because they never expanded. Because they don't take advantage of the marketplace. They don't do Medicaid expansion. They don't have the exchanges. So, but if you were to say to me who would get the hit hardest, North Carolina wouldn't have been my pick. I would have gone with a state slightly more rural. I mean, just that's where you tend to your thinking tends to go rural. When you think who's going to lose the most on this, your thought process tends to go rural. And it's interesting, there's like, I was talking about psychiatric patients in the ER, and patients who have a history of like psychiatric admissions, greater utilization of, non-psychiatric emergency services, rural hospitals feel the strain the most because they don't have the expertise to deal with that. And what can you do but give them a room? They don't have the outpatient settings. They don't have the handoff to maybe an inpatient setting if the patient needs it. It's, rural, the less resources you have, the more you're going to feel the pinch because all you have to offer them is general, a bed, which is the most expensive thing in a hospital.
Well, so we've sized a little bit of the problem here. And then, as soon as this happened, like you said, people started opening up the envelopes and seeing their premiums increase. And all of a sudden now this is real. And people have to make a decision based on their wallets. Well, at that point, a lot of people in the provider world were like, oh, well, this is going to get fixed because this is going to cause so much pain and this is going to cause so much trouble. There's going to be a fix. And I mean, my phone was literally ringing off the hook saying, oh, by April or May, there's going to be a solution. There's going to be a fix. There's going to be there might be a slight drop. So I've got a feeling that you might not be that optimistic.
Yeah. What gave it away? It's, I want to say one thing, and I say this almost everywhere I speak, and I've talked about this issue all over the country. If I had a crystal ball, if I had an accurate crystal ball, I would not be doing this. You could tell from the pictures behind me, I grew up a horse player. I love thoroughbred racing. Love it. It's in my whole family is fans, and we just love to, and I just like to make a $2 bet. That's it, and just watch the horses run. That's, if I had a crystal ball, that's a much better way to make a living than this. But I don't. Yes, a fix. Okay, where do we stand? Let's sum up how we got here politically, not the law itself, but politically. This wasn't a big issue during reconciliation because Medicaid dominated the conversation during reconciliation, because whatever damage is being done to the exchanges, it's a lot worse in Medicaid. And the holes in the system as a result of that are going to, they're going to intersect with this. People who are at the poverty line who can't necessarily now afford this insurance may want to see if they can get on the Medicaid rolls based on the expansion population, blah, blah, blah. Where do they go with the Medicaid coffers facing cuts? So there's an interplay there. But let me talk about the politics. During reconciliation, me included, every single ounce of energy I had went to the Medicaid fight. I didn't really do a lot on this specific issue, but that's not because of the national landscape. That's just because who I represent. I represent a lot of providers across the country, whether they be in California or North Carolina or in cities that rely on Medicaid payments, and very specifically 1115 waiver payments for peer support services. So I was laser focused on Medicaid. I did know that this was happening, but I just couldn't afford the bandwidth. The issue kind of went away until mid-September. Why? The fiscal year ends in September. And more often recently, in recent history than in my earlier years on the Hill, government shutdowns have become a political cudgel. I remember, you've asked me, to be on your show. I've been on several podcasts. I've spoken at conferences. And during the shutdown was my busy time. Andrew, explain this to us. What is going on? So September 30th, the fiscal year ends, money runs out. If it's a good political environment and the appropriators feel like they're close, you pass a continuing resolution, which means all spending stays as is for the next 30, 60, 90 days, whatever, and we're going to finish up. In a highly charged political environment, the shutdown becomes a cudgel. And sure enough, Chuck Schumer and Hakeem Jeffries said, more Chuck Schumer because it comes down to the Senate, because the Senate has the power to shut things down if their demands aren't met. We are not going to let the government continue to operate until the ACA subsidies are fixed. It was the reason for the shutdown. I've been through many shutdowns in my career. My first year on Capitol Hill, 1995, there was a the Gingrich-Clinton, wars, shutdown, 3 weeks, there was a shutdown, so I've seen 2-week shutdowns. I've seen 3-week shutdowns. Usually it's just over a general game of chicken. I'm not giving you that funding. You're not giving me. It's usually a fight over the actual budget. Rarely is it a political issue, unless I remember Trump's first term, there was a shutdown early in his, and you could say, oh, we're not funding the wall, but it was about more than that. This was the Dems' only demand was restore the ACA subsidies. That was it. All the other spending, and remember, this was before ICE started really dominating headlines. This was before Iran. That was it. And the government shut down for 6 weeks, the longest complete and total shutdown in government history. Under Trump's first term, there was a partial shutdown because some agencies were funded and some weren't, but that was only a partial shutdown. This was a 100% across-the-board government shutdown, 6 weeks, over this one issue. And that's why, I'm bringing it back to your question, that's why a lot of people thought, yeah, there's an appetite to fix this. There's an appetite to fix this. Then people start to get angry. Then people start to say these services are starting to, then the TSA starts to not show up to work. And, then the roads don't get fixed. Then the local, the state and local that are depending on government grants for things like transportation and sanitation and environmental, those projects freeze and slowly things start to. So eventually, Schumer relents and says, we've made our point. Now, a lot of Democrats said he's caved or whatever. Let's be clear, or at least in my opinion. He was never going to get these subsidies. He was not going to get a Republican House and a Republican Senate to agree to these subsidies and say, you win, Chuck. It was never going to happen.
Right.
2, he is smart enough to know you can't keep the government shut down forever. People are like, oh, he should keep it shut down forever. When I say people, I mean like social media. I don't mean in the Beltway. We hate shutdowns here. Hate them, hate them, hate them. Right. And do you understand? I mentioned this on the last podcast. Do you understand what government does? Are you cool with like food inspectors not getting paid as they inspect your food? Are you cool with TSA not getting paid as they because that makes them angry and maybe they don't do their job so well. No, we need the government to be open. Sorry to say. So he made his point. And then we started to get some government funding, a 3-bill package, a 4-bill package, and then eventually now the only thing not funded is DHS because of the whole ICE thing. And now that we're in a military conflict and very hyper attuned to things like terrorism, maybe it's not the best time to have DHS shut down. But so that led to a lot of people thinking, okay, there's got to be an appetite for it. There's got to be a fix. I will say this. During the reconciliation fight, there were a lot of members of Congress who would look at certain aspects of the bill and say, I don't like that. I'm going to vote for the whole bill and we're going to fix it later. Josh Hawley was one who said that quite a bit. because he didn't like the provider tax dropping, which interfered with the amount of Medicaid revenue the state could collect, causing, once again, rural hospitals a great amount of pain. There was a lot of talk about, we want to pass this because Trump's still in his honeymoon in his second term. He needs a win. We're not going to shatter his legislative agenda. We're going to give him this win. We're going to go back and fix things. Almost every proposed fix I heard about centered around Medicaid, not the ACA subsidies. So already back in June, July, when they realized there were flaws with this bill that were going to cause them issues back home, the focus was still on Medicaid, not these subsidies. It took the shutdown to shine a light on these subsidies. So the light was shown, people paid attention to it, they got their media coverage. Now what do we do? The first thing I want to go to in terms of a shift in the conversation is, what would a fix look like? And then we'll talk about the chances. Because I don't want to say, oh, here are the chances, and have your people tune out and say, well, why am I listening to what the bill's about if he's going to tell me that the chances aren't good? I will not say the chances aren't good yet, because things change fast in this town. So there's one bill that was written by Chuck Schumer that the first Dem demand was just extend them, just extend the credits for another 2 years or 3 years. And then their demand was, okay, extend them for 1 year, just a clean extension. And they couldn't even get 1 year. So one bill was proposed that would say, I think it was S3380, 85 or 86. The bill would provide Health and Human Services to deposit payments into health savings accounts if the individual had a certain plan between these ages, within 700% of the poverty level. You receive this much based on your age, and it could go towards these subsidies, something like that. It would include funds for cost sharing reductions up to 250% of the poverty level. It would enhance federal match for Medicaid expansion, things like that. The bill's still sitting there. It's not going anywhere. The reason, if you were to look at this bill and say, does this bill have a chance? It's a Democrat bill, it's a Schumer bill, so no. Were a Republican to pick it up and dust it off and do their own things, would it have a chance? Let's talk about that. Let's talk about the key to this conversation, the appetite for action. And remember what I said very, very early on in this podcast about elections. There is obviously momentum on the Democratic side. And like I said before, when I talk about what I do, I keep my personal politics out of it, and I talk about what is objectively in front of you. Well, yesterday in Texas, more Dems voted in the primary than Republicans. That may not be indicative of much, but Dems are putting that up in bright neon lights. In Arkansas, in a Supreme Court judge race in Arkansas, breaking down how the Democrat candidate did in certain counties, was running ahead of Kamala Harris's totals by beyond 40 to 50%. Something is in the electorate that is saying a change might be coming. I'm not saying the Dems are going to, win the House by this many seats, but the conventional wisdom seems to think that there's some kind of change coming. That means for the rest of 2026, Republicans are going to be seeing what they can do to bring back moderate voters. And healthcare is usually a fairly reliable issue to do that on. I would not be surprised, and this is by no means, I can't name who's going to do this or how they're going to do this, but there's two things to focus on in an election when it comes to issues: international and domestic. The international stuff, everyone's going to talk about Iran. Whatever. I'm not a foreign policy analyst. Not my thing. Domestically, if you're a Republican and you want to say, I have a domestic issue that's going to benefit my constituency because there's a problem, this is staring you in the face. All of your constituents on the exchanges who got those premium notices, I guarantee you your phone is ringing and you're going to want to say, I'm going to do something. Now, they're going to want to do something for their message. I introduced this bill. What are the odds of that bill passing? So when it comes to, quote, the appetite for action, I do predict you will see Republican members introducing a variety of bills saying, we're going to fix this, we're going to fix this, we're going to fix this. This will be amongst it. The question then becomes, are they going to act on it? Because elections don't run on, it cracks me up being a student of politics, Democrat, Republican, House, Senate, before anything else, I love this game. I love the game, the business, whatever you want to call it. This is what I do. This is what I love. Whether you could be a journalist, you could be a farmer, you could be a doctor. It's your passion. This is my passion. So above all, I am a student of politics. You will see in poll after poll after poll that the approval rating for Congress is in the, I've seen it as low as 10%. And the highest it ever gets is like 25%. People love to hate Congress. You'll see Democrats support a Republican president. You'll see Republicans support a Democrat president. I think he's doing a good job, blah, blah, blah. Congress, everybody hates Congress. Yet why are they reelected at a reelection rate of 80 to 90%? Especially in the Senate. Why are they always reelected? Because it's the American way, in my opinion, to think, my guy's not the problem. The other 434, they're the problem.
Right.
So all I have to do is go home and say, I wrote this bill because I care about you. The other 434, they wouldn't do it. I did it. The other 434, I'm going to fight like hell to make sure they vote for it. And the reason I can say this with some confidence is because of what I do in behavioral health. In 2018, Trump was in his first term. He was coming up on a midterm election that was going to be catastrophic. And we all knew it. And the way you know it in this town is by retirements in the majority. Count the retirements. Because no one in the House majority wants to stick around and be in the minority. It's the worst. And it's different. Senate minority, you got a little clout, smaller club. You can do some things in the minority. If you're in the House minority, you're got a long couple of years ahead of you. You just don't have the clout that you have in the majority. It's incomparable. And just like in 2018, in 2026, we're seeing retirements. What happened in 2018? We were, in our space, fresh off the wind from the Comprehensive Addiction Recovery Act, CARA, in 2016. And there was talk of doing another one. Okay? I kid you not, I saw 73 different bills introduced on SUD issues. Everyone had to go home. I even had a member of Congress who I will not name, who has been a huge supporter of SUD, introduced a bill, short bill, couple of pages, saying this, this, this. And I said to their staff, they're like, can you promote this? Can you, advocate for this with other offices? Do us a favor? And I was like, I'm like, why are you wasting my time? And I rattled off the other bills that were already out there. And they're like, Andrew, you know better. We have to go home and say, look what we're doing. We have to do it. 73 bills, that became the Support Act. The Frankenstein's monster that became the Support Act because they cobbled them all together. So I've seen how the top issue in the news that runs well in a domestic issue election can generate legislation. I've seen it happen. It wasn't that long ago, 8 years ago. That's why I think you're going to see a lot of bills starting probably this month before the April recess start to come out. We're going to, the President's reconciliation, we're going to fix this. We're going to fix this. We're going to fix this. Will any of them become law? No, but it sets the stage for the Frankenstein's monster that could become some kind of remedy somewhere, somehow, some way for some kind of action. Will it address the subsidies? I don't know. Will it address Medicaid? I don't know. But I can guarantee you we come back in 3 months in May, and I'm going to be able to rattle off some bills that are say, see, they're starting to pay attention to what was done in reconciliation. And now they can introduce these bills. They're not, reconciliation was Trump's. Am I supporting the president or am I not supporting the president? And at that time, it was not good for a Republican not to support the president. Now they can go home and say, this is me. This is what I am doing. Because it won't be one huge thing that the whole country is paying attention to. It'll be their little thing. Eventually, it could become one big thing. But, and we see that happen all the time. In 2016, it was the 21st Century Cures Act. 2018, it was the Support Act. It happens. So there will be legislation. What chance each piece of legislation has, that is way too murky in the crystal ball.
What is there a piece of legislation that you think could get passed through? Is there something in your, like what you've seen over the years, is there something someone could introduce?
Because I think everybody that's listening understands the performative nature of introducing something that may not actually pass. I think everybody kind of understands that. But it's like, I think Mark asks a great question. It's like, given your experience, is like, is there anything in your mind that could thread the needle?
Here's the thing. The word tax and the Republican Party have a very complex relationship. This is a subsidy, or a tax credit. And you would think that that's something Republicans like, tax credits. At the same time, tax legislation or anything having to do with the word tax becomes incredibly complicated because of the whole revenue thing I talked about earlier, especially if you're going to do it through a reconciliation process. So I would say it's a good segment. It's a good segue into something I wanted to bring up anyway. What is palatable? A lot of people thought maybe, just maybe, a second reconciliation was palatable.
Yeah, I've heard rumblings of that.
Rumblings. You've heard rumblings. Here's the problem. It's already March. You can't just yell reconciliation and it's on. It is a very complex process. You can't just come up with a bill and say, we're passing this under reconciliation, so we don't need to go through the whole, 60 votes and 50, simple majority, blah, blah, blah. It is a very, very complex process. Back in September, there was talk, I want to do a second reconciliation. And there was some, maybe we can do it. That chatter has really died down. And I'll be honest with you, last November's midterm, I wouldn't say midterm, off-year elections, New Jersey, Virginia, put a damper on that. The shutdown put a damper on that. And the calendar puts a damper on that. Because the first thing you got to do is pass a budget resolution. You can't pass a budget resolution until you have the president's budget. We're not getting the president's budget until we were hoping we'd get it sometime in the next couple of weeks. Now we're hearing we may not have it. If we don't get the president's budget in the next 2 weeks, you're staring April in the face with no budget. And then you've got to write the bill, pass the budget resolution, go through all the parliamentarian hoops in an election year where the legislative calendar is already like that big. It's just that it doesn't seem feasible. Again, I'm not going to say it's not going to happen because I gave up the prediction business a long time ago. If they were to try reconciliation again, not only does the House have a razor thin, 2-vote majority, you've got a Republican who's now in Thomas Massie voting against everything the president puts out of a personal grudge between the two of them. You've got Senator Collins in Maine in a very tight reelection race, probably her last. And can she afford to make further cuts or do further things? You've got, now I mentioned the election last night in Texas. 2 House Republicans lost their primaries last night because Texas insisted on redistricting in order to what they saw give an advantage to their Republican majority in the House. And because of that, one redistricting, or there were 2 redistricting, Dan Crenshaw lost because of his redistricting. Then you have another member of the House who ran for governor in the primaries and lost. And then you have another member of the House who ran for state AG, and I think he's in a runoff. How much hustle are they going to have to come back to Washington for these votes? If you'll remember the last reconciliation, and it happens a lot, they're going to have the vote. They're going to bring everybody back for a quick vote. They're going to keep everybody here to keep it open to do a vote. Johnson doesn't have the right situation to pull this off. 2-3 vote majority and 3 or 4 more members who really are going to mail it in from here on out. It would be the heaviest lift. And so I don't see reconciliation. What I do see is, and like I said, I don't know why, but senators and congressmen seem more focused on Medicaid than they do on this ACA subsidy issue. Why? Probably the impact on rural hospitals.
Right. That's what I was
Medicaid's
gonna
the main
say.
payer, you know? So Josh Hawley, like going to bat for the Medicaid population, we have a saying, everyone has this saying, but we use it a lot these days in Washington. Didn't have that one on my bingo card. Kalshi didn't have that trading website, didn't have, will Josh Hawley become a champion for the Medicaid population? Because I would have been like, no. No one had that on their bingo card. So if there is any kind of fix coming, I really tend to think it's going to be on the Medicaid side before it's on the ACA side. One more explanation for why. You asked, what's the appetite? And I was talking about tax and the Republicans and how they have this really complex marriage. One of the other thing that are like Republicans, because of their DNA, for the most part, do not like the ACA. They
Right.
don't.
Right.
They don't like it. End of story. President Trump really doesn't like it. We won't get into why. President Trump cannot stand the ACA. Steve Scalise, number 2 in the House, not a fan of the ACA. Senator Thune, majority leader, probably, he's pretty smart and he's probably one like, it's doing some good work in my state, but he's not going to crusade for it. When you talk about Medicaid, you can still talk about Medicaid outside the auspices of the ACA, because Medicaid's been around for 50 more years, 40 more years. Medicaid's been around since the 60s. And if you talk about Medicaid to a voter, you don't even have to mention the ACA, even though the ACA is responsible for expansion and new coverages and things like that. You can talk about Medicaid and leave it as Medicaid and never mention the words ACA, and your constituents will listen. The ACA tax credit is the ACA tax credit.
Right.
You cannot talk about it without bringing up the letters ACA. And it's really, really risky politics for the Republicans to go say, we can make the ACA better. Because you'll notice every time they try to do something about the ACA, what's their tagline? Repeal and replace, or a better bill.
Right.
They never say we can improve it. And what you're asking them to do, Mark, is take the ACA and make it better. It's not in their DNA. They have no desire to do it. Especially with this White House. This White House has a tendency to want to make everything their idea. And I'll give you an example. I work in substance use. A couple of weeks ago, they announced the Great American Recovery Initiative, and they mentioned this whole outline of things they're going to do. Everything they mentioned, those programs already exist. It would be quite simple to just take the money you're spending on this Great American Recovery Initiative, invest in these programs that already exist doing the same thing, and you're done. No, this administration has to say it was our idea. We did it. So if there were some new kind of tax credit for ACA subsidies, I can guarantee you there would be a White House and saying they would be Trump tax credits and all that, and it would have to be his idea. That's just the way they operate. So I'm not holding out too much hope for a Republican-led Congress saying we're going to improve the ACA because it's just not in their nature.
So constituent pain really, I mean, the sad thing is constituent pain is really not the motivator here, right?
No, which makes me pull my hair out. Yes, I used to have more. I mean, it's funny. Hey, if you told me at my age in my mid 50s I'd have this much, I'd take it every day. So I'm not complaining by any stretch. But look at the reconciliation. It is common knowledge that those of us in D.C. rally our grassroots, call the offices, do this. The amount of work I saw done to save Medicaid and other things that were in the ACA in the reconciliation, we rang the phones off the hook. I am not exaggerating when I say we probably outcalled the other side, if there was an other side, better than 100-1. I don't think there were a lot of people picking up the phone and saying, you cutting Medicaid so you can give tax breaks is a good idea. I'm sure there are people who thought it, but I don't think the phones, I guarantee you, the side saying protect Medicaid, when it came to flooding the offices, absolutely clobbered the pro-tax break side, and it didn't matter. But that's not to discourage people from doing it. You've got to look at the politics and how it influenced. Like I said, this was Trump's signature. I'm back. This is the 4-year outline for the rest of my administration. He was in his honeymoon. His approval ratings were still moderately decent, and no one was going to buck him because of the political environment. I got news for you. The political environment that bill was passed in and the political environment of March 4th, 2026 are very, very different. So even though there's more political will now to maybe make some fixes and fix some of that pain and constituent pain you were talking about, it's still not going to be, I still don't see it happening in the tax credit space for subsidies. I see it happening in the Medicaid space.
And largely because of the rural hospitals, largely because of the rural economies.
Rural hospitals,
where the rural hospitals are largest payroll in these communities. Yeah.
Yes.
Okay. And so it's like, do you want to peg some odds on that?
No.
Okay.
I am very curious. I'm curious to see, what if I'm wrong, wouldn't be the first time. I don't like to say that out loud. And if, my mother ever gets around to watching this, she's never going to let me live that one down, let alone my wife. I've been wrong before, but if you're a member of Congress, you can't, if you're in a purple state, North Carolina, even Ohio, Pennsylvania, look at the approval ratings, look at Trump's approval ratings. It would not be the wisest thing politically to say, I'm running in Trump's pocket and I'm running on his record. You're going to have to show something that you care about the constituency. You mentioned constituent pain. What's the big thing now? Affordability. This is affordability. This isn't healthcare, and that's what burns me about a lot of the healthcare discussion. This is economics.
Right. Exactly.
People being covered is good for the economy. More productive at work means paying more taxes, means buying more goods. Medicaid, I hear the refrain a lot, why should I pay for someone else's health care? Because it's in your best interest.
Well, right.
If they are healthy, they are working, they are buying homes, they are paying property tax, everyone benefits. But
and I know this is, I mean, this is like preaching to the converted here, but I mean, obviously, you mentioned the stats about the emergency room visits, and it's like 18 people generate, the majority of the expense. So, I mean, the idea of like, if we can keep those people, with proper primary care and with proper prevention, and you keep them out of the emergency room, then everybody's bills go down. I mean, I think that's the thing that
or
drives
out of jail. Or out of jail.
Exactly. And so I think that's the thing that drives everybody nuts is like, there are things that we know we can do that are common sense that actually lower costs and address the affordability. There's not a political will to deal with it.
Yeah, at least last July there wasn't. Now we're in March. Things are different, and we'll see what the political will is. You have to understand it's not a stretch to ask you to understand how hard it is to work on this when we just bombed Iran, and to say nothing of the fact that we have no idea what happened in Venezuela. And if I've got a member who is interested in this work and wants to work with me, if they're also happens to sit on intelligence or foreign relations, I can't get a minute with them. Just forget it. It's the oxygen. It takes up all the oxygen in the room, and who knows what's happening tomorrow. So remember, I said last time, the enemy is not the Democrats. The enemy is not the Republicans. It doesn't matter House or Senate. The enemy for people like me and people like you is the calendar. So now, for the next couple of weeks or however long, the House and Senate, what do they have to do? Debate war powers. Give Trump war powers. He's probably going to ask for a supplemental appropriation for this. They're probably going to have conversations about a CR for Homeland Security. On and on and on. That is going to dominate the landscape. What time is left for this?
Yeah, right.
I don't know.
Andrew, this has been so educational. I think our audience.
We're super fortunate to have access to you, Andrew, and glad that you like coming on here because you tell it like it is, and the value. The value for our people is like they want to be told like it is.
I hope so, because I was at a conference last week and someone said, "Thanks for telling it like it is," and I'm like, what choice do I have? I was like, so.
Hope is a dangerous thing.
It is.
Well, thank you for being a part of the show. And
absolutely, that's
a wrap for this episode. On behalf of Jeff, myself, and the entire MasterMined crew, thank you for joining us today. If this episode with Andrew sparked any questions, please drop them in the comments section, and we'll definitely get them over to Andrew and get them answered for you. We'll see you next time on MasterMined.
That wraps up this episode of MasterMined. Thank you so much for joining us. And remember, MasterMined is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on MasterMined, your behavioral health playbook.